Coming up, we'll be on location at LDRTC in Fairfax, Virginia, a leading nonprofit clinical research organization focusing on lysosomal disorders and Gaucher disease, with one of this region's top doctors, Dr. Ozlem Goker-Alpan, the founder and president of LDRTC. Welcome, Dr. Goker-Alpan, to the Top Doctors Interviews program.
Thank you, Nicholas, for inviting me to the Top Doctors interview. I'll be delighted, actually, that is, to talk to you today.
Oh, wonderful. We've got a lot to talk about, but before we get into that, I wanted to touch on your background. First of all, you're the founder of LDRTC, located here in Fairfax, Virginia. You're recognized as a top doctor throughout the region, not only the DMV region, but pretty much worldwide as well. And in your pursuit to provide individualized care and treatment for lysosomal disorders and rare diseases as well. I wanted to begin, Dr. Goker-Alpan, by asking you about your vision for your practice.
Thank you for asking the question. Lysosomal and Rare Disorders Research and Treatment Center, or LDRTC in short, which is located in the heart of Virginia, Fairfax, Virginia, at the Metro DC area, started with actually a vision about a decade ago to provide not only medical care, but also a medical home for individuals with these rare diseases with an emphasis of lysosomal disorders. In this very unique center, probably it is one of a kind in the world, that started with a mission for a very sophisticated approach for rare disorders. So a rare disorder is defined from multiple institutions. In US, it is anything less than 200,000 as a whole. European Medicinal Agency and WHO give numbers, and a disorder which affecting the individuals less than 1 in 50 or 1 in 65 per 100,000. At LDRTC, we focus on a group of disorders called lysosomal diseases. Even though they are rare and some of them are ultra rare, actually a baby with any form of lysosomal disease is born every half an hour in the world. So collectively, they are not as rare.
You're pioneering clinical research for rare diseases and disorders. What exactly are lysosomal disorders?
Thank you for asking the question. We said actually lysosomal disorders collectively may not be that rare. So lysosomes are small compartments in the cell that are not only responsible as units as garbage disposal. So basically I usually give an example that these small units act as little garbage trucks to carry the unwanted molecules or broken down molecules to circulate within the cell and outside to the outside of the cell. And when they dysfunction, usually due to the absence of a protein that is located with the lysosome, the whole homeostasis or the balance of the cell changes. So even though these are little vesicles and multiple cells in the tissues and multiple tissues in the organs of the whole body gets affected. So most commonly these disorders affect the neurological systems and also the other organ systems such as the hematological or the blood parts of the body, including liver, spleen, bone marrow, and presenting with various manifestations. Mostly are diagnosed early childhood, the ones that are severe enough to be recognized. However, the less severe forms of these disorders that can be seen in the patients who are adults or later through teenage years may be missed as a diagnosis, and these individuals may be diagnosed with multiple disorders like pain syndrome, renal failure, heart disease, bone disease in case of Gaucher disease, which we'll be discussing. So the recognition of the symptoms is very important to provide care and treatment for the treatable forms of lysosomal disorders.
You touched on Gaucher disease. Can you tell us what exactly that is?
Absolutely. Actually, October is the Gaucher Disease Awareness Month, so it is an opportunity for us to discuss this rare disorder, which is not rare in some communities. Gaucher disease is the deficiency of the lysosomal protein or enzyme that is called glucocerebrosidase, and this enzyme or protein is responsible for degradation of these very specific lipids. They are called sphingolipids. These lipids are not the fats that we eat from, as in our diet, but the essential part of cellular elements such as the membranes. So the deficiency of this enzyme leads to accumulation of this abnormal lipid within the lysosome, giving a variety of conditions such as an enlarged liver and spleen, decreased platelets, anemia on some instances, and neurological manifestations in the severe forms of the disorder. I said this is a rare disorder. The given number is 1 in 100,000 to 1 in 40,000 individuals could be affected with Gaucher disease cumulatively. However, in some ethnic populations and groups such as Ashkenazi Jewish, the carrier rate for Gaucher disease can be as high as in 1 in 10.
That's quite significant. 1 in 10 is not as rare as we would think.
No, absolutely no. So if you were to go to cities, big cities such as New York City, Los Angeles, probably you're going to run into individuals with Gaucher disease who don't know that they do have Gaucher disease, or some of them are carriers.
And Dr. Goker-Alpan, are there different types of Gaucher disease?
Yes, we talked about the severe forms of Gaucher disease. So basically, there are two major clinical types. One is called neuronopathic Gaucher disease. These are the most severe forms that the presentation is usually early childhood or infancy. There is very little of this enzyme to metabolize the sphingolipids, so there is primary neurological involvement with the presentation of brainstem dysfunction, swallowing abnormalities, and or this is what is called the acute neuronopathic Gaucher disease or type 2 Gaucher disease, which is actually an ultra rare disorder. Currently probably there are about 10 patients in US. The chronic neuronopathic Gaucher disease, which is called also the type 3 Gaucher disease, does also present with the primary neurological involvement but has significant systemic involvement, and that is diagnosed usually in early childhood but not as early as the Gaucher disease type 2, which has a neonatal and even like before the birth of the baby presentation.
What causes Gaucher disease?
Gaucher disease is a genetic disorder. It is inherited what we call is as an autosomal recessive fashion. So each parent are not affected with Gaucher disease, but they do carry one faulty copy of the gene, which is called GBA1. So what we call is pathogenic variants in GBA1 is the actual cause of Gaucher disease that leads to the deficiency of this protein, which is called glucocerebrosidase.
And for those individuals that may be thinking they may have Gaucher disease, what are the most common symptoms that people should look for?
So let's talk about the GD1 or Gaucher disease type 1. There is a misnomer here. Occasionally it is referred to adult onset Gaucher disease or late onset Gaucher disease, which is absolutely not correct. Actually, it can arise during early childhood too with quite severe manifestations. Depending on this GBA1 variants, the severe variants can lead to actually early presentation of type 1 Gaucher disease. despite the lack of primary central nervous system involvement, so such as the lack of seizures or discoordination, these children may present with an organ enlargement, spleen enlargement per se, which could be easily missed in a normal child examination. The most common presentation what we are seeing is actually decreased platelet count that can occur concomitantly with a viral infection, and these kids or adults can be diagnosed what is called idiopathic thrombocytopenia or occasionally ITP. And some of the patients actually can be inadvertently diagnosed with malignancies due to the severe enlargement of the spleen.
How would you diagnose Gaucher disease for people that may think that they have it and say they come to your practice? How's it diagnosed?
So how we diagnose Gaucher disease, first is the suspicion. So it is very important for a medical practitioner to keep Gaucher disease in the back of their minds, especially when they are seeing a child or an adult with some hematological abnormalities and they are especially thinking they're doing a bone marrow biopsy. So these individuals may do actually have Gaucher disease. So the definition of Gaucher disease is the deficiency of the enzyme or enzymatic activity for glucocerebrosidase. So we do, the first line of diagnosis is the measuring the glucocerebrosidase activity in the blood. That can be done in the whole blood or the dry blood spots that are also used for newborn screening can be used for the diagnosis of Gaucher disease. So concomitantly at the same time that we also do molecular analysis for the glucocerebrosidase gene, which is a tricky gene because even though it's not a very large gene, there is what we call there is a pseudogene that runs in the opposite direction, which this gene doesn't really produce any protein product. It can get entangled with the actual gene and can cause actually severe arrangements that can lead to the GBA1 pathogenic variants. So what is important is to send the molecular analysis to a laboratory that is experienced actually analyzing the GBA1 gene, and the gold standard for analysis is what we call is the full sequencing or Sanger sequencing rather than the next generation sequencing panels, which can occasionally miss large deletions or some rare arrangements. In addition to the measurement of the enzymatic activity and also molecular diagnosis, we also use the elevation of biomarkers, which is very specific for Gaucher disease, which is called lyso-Gb1. This can differentiate Gaucher disease from some other disorders that can mimic Gaucher disease, such as Niemann-Pick, AB. So this is significantly elevated in the severe forms of Gaucher disease or even the less severe forms of Gaucher disease, such as GD1, lyso-Gb1 is expected to be elevated. So now we can accurately diagnose Gaucher disease using these biomarker in addition to molecular analysis and enzymatic assay.
And once the Gaucher disease has been diagnosed and confirmed, is it something that we have to live with for the rest of our lives, or is there a cure for Gaucher disease?
There is no cure for Gaucher disease yet. However, Gaucher disease remains at the leading edge of genetic therapies. I need to say that the first interventional therapy for a genetic disorder has been developed with Gaucher disease, which is about a quarter century ago, more than 25 years. So this was enzyme replacement therapy, giving the enzyme that was missing, which truly changed the lives of the patients who had severe complications due to lack of treatment, such as very severe bone disease that requires surgeries, constant pain, failure to thrive for kids. So we don't see those symptoms anymore, and we don't see those complications in a child who comes with a diagnosis of Gaucher disease, because there are multiple therapies available that has been developed over a few decades. First and foremost, the standard of care of Gaucher disease is enzyme replacement therapy, and there are multiple products in the market for that. And also there is what is called substrate reduction therapy. So the aim is to decrease the production of this abnormal lipid from several pathways. So if you think that there is a faucet and there is your clogged drain, if you actually get less water in, you can your clogged drain, if your deficiency of the enzyme, the water can pass through without pulling in the drain. So this is an example of substrate reduction therapy. But what is most exciting is now actually there are therapies that are in development with the hope that these treatments can pass the blood-brain barrier. So far, unfortunately, the treatments that are approved, they did not have much success for the primary neurological manifestations of Gaucher disease. So we are running few trials for a small molecule that can pass the blood-brain barrier to decrease this collection of the substrate. And the other one is everybody is holding their breath, obviously, is the gene therapy. And we have two different gene therapy trials for adult for type 1 Gaucher disease that are currently enrolling patients. And also we are following the infants that has received gene therapy very early in life. These infants suffer from the complications of severe Gaucher disease. So we are hoping to get official results at the conclusion of the trials.
And you touched on the symptoms. What are some of the severe health complications that can occur with Gaucher disease?
So we need to divide the discussion as neuronopathic versus non-neuronopathic Gaucher disease. So I a little bit touch base for the neuronopathic forms of Gaucher disease, probably, which is actually more common in the whole entire world. However, in US and in other advanced countries, there is very extensive screening methods employed to diagnose patients with Gaucher disease. Type 1 Gaucher disease is more common. So let's say if the patient was not diagnosed on time and the treatment was delayed, so the most feared complication is what we call is osteonecrosis, or the destruction of the bones, especially the hip bones, so that the patient not only has what we call is acute pain crisis, it is a very severe pain that can be only relieved by the significant pain management. These patients usually may need to get hospitalized, present to the emergency room. This is not only the introduction, which is important, but the end result, which is the destruction of these main long bones, such as the hip bone, the long leg bone, that will require surgical treatment and or chronic pain management. So if a patient is not treated properly and on time, this is the most feared complication of Gaucher disease, which will be a primary bone disease. So this is what we call is a complication. There are also some rare, what we call is comorbidities, or the association of Gaucher disease with other conditions such as cancer. Unfortunately, patients with type 1 Gaucher disease may be predisposed. Some other hematological cancers such as lymphomas, or a very distinct cancer from the bone marrow, which we call is multiple myeloma. We do screen all the patients for this occurrence because of the inflammatory milieu. These patients may present with increased immune globulins because of the immune stimulation, but a very rare subset of patients may develop this rare form of cancer. It is predictable, it can be screened, and this is a very rare condition. I had sent only few patients to further treatment and evaluation for the suspected multiple myeloma. Another rare occurrence in Gaucher disease, which actually is getting a lot of buzz, is the association of Parkinson or Parkinsonism, which is a very common neurodegenerative disorder. This is with and without dementia, actually can be more commonly observed in carriers of Gaucher disease. Michael J. Fox Foundation is giving grants to understand why this is occurring and whether the therapies could be developed for this.
And Dr. Goker-Alpan, can patients live with Gaucher disease?
Absolutely. There is a misconception that the severe forms of Gaucher disease are inadvertently associated with early mortality. This can be actually true for a very severe form, which is type 2 Gaucher disease, which is the acute neuronopathic form. By definition, unfortunately, these children do not live beyond age 4. However, I have few patients that defy the odds. One of them is currently about age 8, and he is living without these altruistic measures such as putting on a ventilator. However, probably with the advent of enzyme replacement therapy, what really changed is what we call is the lifespan for this chronic neuronopathic form of Gaucher disease or type 3 Gaucher disease. Multiple websites, including NORD, was giving a lifespan about age 30 for these individuals as their lifespan. However, with now the advent of therapy, I have many individuals that passed obviously this age and they are living healthier lives. So basically, I need to emphasize that that age that is pre-enzyme replacement therapy, age life expectancy, that these individuals used to actually succumb to the severe complications of the severe systemic disease such as cirrhosis, portal hypertension, or other ailments. However, we don't see them anymore in these adults that actually can live with even with the chronic neuronopathic form of Gaucher disease, which has a very wide spectrum. I have actually patients that are successful lawyers and data analysts in technology companies. So basically, they may have one seizure in the past and they are actually successfully maintained with enzyme replacement therapy or other forms of therapy when indicated. For type 1 Gaucher disease, obviously this life expectancy is not an issue. However, there are some studies that these patients may be vulnerable to infections. There is a study that was published about 15 years ago when they did the analysis on a large cohort of patients. The common cause of mortality was due to infections in later years. And also the association of Parkinson disease, Parkinsonism, may lead to earlier mortality in some individuals with Gaucher disease.
Can Gaucher disease be prevented, Dr. Goker-Alpan?
So as prevention this is a genetic disorder. So this is not something we would take a medicine and can prevent that. So obviously the prevention and early diagnosis can be talked about with this early diagnostic techniques such as newborn screening. And when a couple has a child with the most severe form of Gaucher disease, type 2 Gaucher disease, we counsel them to have a planned pregnancy, and actually we refer them through a procedure what is called preconception genetic diagnosis. So this is how actually Gaucher disease can be prevented by selecting the embryos that do not carry any GBA variant, and these embryos can be implanted through the technique of IVF. Also, in the communities where Gaucher disease is common, such as Ashkenazi Jewish, there are attempts to prevent Gaucher disease by assessing the carrier status of the individuals and having a partner not carrying or not being affected with Gaucher disease is a way to prevent the disease.
Well, that was very informative, Dr. Goker-Alpan. You're helping people deal with these rare disorders that can be very difficult because there's such little information as far as, how they can affect our lives. You're doing great work. So I want to thank you so much for joining us, educating us about not only Gaucher disease, but other rare disorders as well. And you have a wonderful practice here in Fairfax, Virginia that's helping so many patients. Pioneer, truly a pioneer. So thank you for joining us and being a guest.
Thank you, Nicholas, for not only coming here and interviewing us and also seeing our institution, but also raising awareness about Gaucher disease during the month of October. Thank you.